So all the way back in July 2020, we launched a survey we call the Arizona Frontline Worker Project. And that asked grocery store workers primarily to talk to us about how they were doing in their workplace, right? There was a lot of uncertainty in the summer. And then we just finished up with another round of that survey in February. And what that tells us is that most, let's call it about 60% of those workers feel safe at work, but that means about 40% still do not. And they're very anxious. There's signs of depression, as well as high levels of stress that are still continuing in that population.
Businesses are private companies, so it's up to the employer to help enforce some of these requirements like wearing a mask or physical distancing. Do they feel supported, the grocery store workers?
Not at all. That was the number one thing we heard loud and clear was that lots of workers reported encountering difficult, agitated, angry customers, and a lot of them felt verbally threatened, sometimes even physically threatened. But when they were telling us those stories, it was always accompanied by, I wish management would do something to support me. And so even though we know today that grocery stores still have signs saying that masks are required, social distancing is requiring, it's not being enforced. And workers are really left to their own devices to figure out how to navigate those difficult situations. And it's stressful and it's damaging to their mental health.
Did your report find anything about why employers are hesitant? I imagine it probably has something to do with the bottom line, but also not creating an uncomfortable environment inside a grocery store.
Right. I think the question comes down to responsibility. And so you could see both sides of the coins. And so we didn't get to talk to any employers. We're just listening to the voices of the workers. But if you think about the situation, what does a store manager, what does a company policy want? Do they want their worker to have to confront someone who's going to get physically violent with them about wearing a mask? And the answer is probably no, right? Which is worse. And that's a really difficult situation to be in for those companies. And lacking federal, lacking state policy on how best to manage that, they've really been left to themselves. And we see this very uneven application of, do I have to wear a mask in the store? What if I don't want to? What if a worker asks me to? What do I do as a customer? And it's similarly puzzling for those workers in terms of how do they sort of protect themselves?
The workers that you surveyed, how did they feel about having to wear a mask or gloves for their own personal protection? And then, of course, vaccines came into the picture here.
Sure. So going all the way back into July, one of the surprising things that we found is a worker's sense of safety isn't really based on those physical things, having to wear masks themselves, having partitions put up at checkouts, having signage. Those things were important, but what was most important was having access to regular safety training, which I think speaks to this question of management and enforcement, as well as being able to tell customers to sort of to follow the right policy.
You mentioned that your survey took place in July, which was well into the pandemic. Anything in your research show that their feelings had evolved over time?
A couple of things did change. One was sort of the fear of COVID seems to have gone away, at least partially, replaced again by sort of this fear of interacting with difficult customers. We also saw more folks not willing to get vaccinated. So we asked a hypothetical question. If the vaccine was made freely and conveniently available to you, how likely would you be to get it? And that number went down by about 10%. Those that felt that they would be strongly likely to get it remained the same, but those were undecided tended to move towards being opposed to vaccination. And that was surprising.
Did they offer any reasons for coming to that decision?
We did ask, what would be a reason that you would get vaccinated and what would be a reason why you wouldn't get vaccinated? The number one reason why they wouldn't get vaccinated was fear about possible side effects.
And finally, Dr. Merritt, you mentioned side effects like anxiety. I mean, that can be detrimental to a workplace, and these are critical jobs that these individuals are performing. Looking into the future, what does that tell you about safety in the workplace, and is it sustainable for people who are managing these issues to be at the grocery store to service everyone else?
I don't think these current levels of mental health distress are sustainable at all. What needs to be done is we need better guidance from the Occupational Safety and Health Administration with cooperation from the CDC so employers know what is required of them should they enforce mask policy. So hopefully we learn from this pandemic and provide these employers from large to small with clear guidance on how to do that. And I think that would be beneficial to the workers there, that they can know what management is expected to do and trust in that. That's beneficial for customers, that they know what to expect when they go into a store. And that'll make the lives easier of these companies in terms of what policies they need to have in place.
Okay, thank you for your insight, Dr. Brian Mayer, the Director of Undergraduate Studies at the School of Sociology at the University of Arizona.
Thank you.